general anesthetic. So this can be quite straightforward. The intraoperative goal, it's very simply, I want the patient to get through this pretty, horrendous journey, potentially horrendous journey with minimal physiological and psychological alteration. And the way I do that is, a whole bunch of things, but medical knowledge combined with technical skills in airway management, ventilatory support, and circulatory support, as well as a lot of very interesting medications and very potent medications. The way we do that is going through this whole process. A step-by-step sequence for the general anesthetic, which I've mentioned before. We've got all these before theatre tasks and all the in-theatre tasks, which we'll go through in a second as well. On pages 6 to 8, I've got a whole bunch of anesthetic assessments. So the thing about these assessments is they're very checklistable, So if you can fill this checklist out, you can be at the level of a very good basic trainee simply by following a pro forma. This is really reassuring for you. I care more about your ability to be able to cover all the points superficially every single time, and not about the depth of knowledge necessarily. The depth of knowledge will definitely come to you over time, but I want you to cover all these points without fail. So this is a very busy, pro forma, which I, encourage you guys to use just so that you don't miss anything, because that means that I know that you're thorough and competent in following these processes. But really, this is literally what I ask. And you'll be very familiar with this. So, do you have any prior general anesthetic issues, post-operative nausea, vomiting, or PONV, or any family history of issues? And then I specifically ask about medications and allergies, any problems with cardiovascular, respiratory as the most important systems, and then any other systems that they might mention. And then I get an idea of overall function by asking the question, can you walk up 2 flights of stairs without stopping? Now, really importantly, if they don't have stairs, I don't really care. I need to just know what their exercise tolerance is, whether it's asking them specifically what their activities of daily living that they can do, whether they can do some gardening or lawn mowing or walk 4 blocks to the shops or whatever it is. Your boss and your supervisor will be really, really happy with the fact that you get an idea of their global functioning specifically, especially that's a problem. As I mentioned, medication list, allergies, and whatever those allergies cause, whether the patient has fasted, if they have reflux, and then do an examination, which is really just the airway exam and auscultating the chest, and then a dental exam, and then noting any relevant investigations. So again, this is very checklistable. I go through the previous pro forma if I was junior, just to make sure I don't miss anything. And I've also given an obstetric pro forma and a pediatric pro forma because they're slightly different. And again, just by filling out those, I want you to be able to really impress your consultant. And also on a patient-centered approach, if you take away a lot of that, I guess the checklist stuff from your consultant, you really offload a lot of the, mental energy that they can then focus on other tasks as well. So it's really helpful for your supervisor on many levels to know that you're very thorough. So I just want anyone can do this, use a checklist and ask this over and over again for every patient. But the real challenge is the application of this information, and that's what we'll focus on. So again, do this time and time again until it's absolutely boring. Watch the YouTube videos which are on the channel, and I've gone through it in a lot more detail. And what we'll go through now and in the future is about how to practically apply that. So what's most difficult is knowing when to proceed or postpone. And we'll go through this in the assessment of the cardiac patient for non-cardiac surgery. So again, imagining you've got all of this history of this patient, we then want to go through whether this patient is ready for surgery or not.